Bukulmez, and she will talk about full disclosure of medical errors.
Good morning.
Morning. Morning.
Very glad that everybody's here, and I see very familiar faces, and also a lot of friends who are here to exchange information and to learn together. Let's look at another example of a human face in a medical error.
For Sorrel and Tony King, life in Baltimore was very, very good. Tony was thriving as a stock trader. Sorrel had her hands full raising their 4 young children. Jack, Eva, Relly, and the youngest, Josie.
Josie was fourth, and at least for me, when I remember coming back from the hospital with her, coming back home, I was like, okay, now let's here's the candles, we're done. The stars are all perfect. This whole constellation was failing.
On a cold January evening in 2001, everything changed for the Kings. Freak accident. 18-month-old Josie wandered away from her parents, crawled into a bathtub, and turned on the hot water, badly burning herself.
We took our eyes off of her for a couple minutes and, heard a scream.
Right, immediately called 911.
And then they took us to hospital.
The King's fears gave way to relief when Josie ended up at Johns Hopkins, one of the best hospitals in the world. She was in good hands. After a couple of weeks, Josie had recovered well enough to transfer out of the intensive care unit. She was through the worst of it and just days from being discharged home. But then things began going wrong. Sorrel and Tony began noticing obvious signs that Josie was suffering from severe dehydration, a common threat to burn survivors.
She just looked like thin, her coloring was off, her eyes were kind of, it's like she was passing out or something. So I called a nurse over, I said, "Something right, can we take a look at her? Let's call a doctor. Let's call a doctor." She looked at her, she said, "No, her vitals are fine, she's fine." And I said, "Can someone else has got to look at her?"
Josie desperately needed to be treated for dehydration, but nobody listened to Sorrel and Tony's concerns, and Hopkins failed to act until it was too late.
I looked at her and her eyes had rolled back in her head, and I said, "Josie," and then I just kind of screamed for help. And then the next thing I knew, this whole team of people, doctors and nurses, and with these big tables and these metal tables, and all these people came running in, and they just made me leave, and just sort of standing there. And then they put me in a room with a chaplain, and I knew I'm gonna be good.
On February 22nd, 2001, Josie King died at Johns Hopkins Hospital, a result of severe dehydration missed by her caregivers, the possible misuse of narcotics, preventable medical errors. The King family had fallen prey to a silent killer, the epidemic of medical errors plaguing hospitals all across America.
Medical error, yeah. Mistake. These people are the smartest of the smartest.
It never really even, weird, I never really even heard the term medical error. Knew that was, that this was going on.
In fact, a year before Josie's death, the Institute of Medicine shocked the nation with news that medical errors were a widespread and devastating problem, killing more Americans every year than auto accidents, breast cancer, or AIDS.
What we need is outrage. We need outrage. We need the public to say, no, I don't want a healthcare system at any price, let alone close to $2 trillion, which is going to hurt me when it tries to help me.
Technical difficulties. All of us here in this room today, we are that public. We don't want a healthcare system that hurts us instead of helping us. We don't want to go into a hospital and hoping to get better, coming out being harmed. And looking at everybody today, I see the good news. There is a current and very important transformation towards full disclosure of medical errors, both in healthcare and also medical liability insurance. A great news. Every healthcare professional that I've ever met, my own healthcare professionals or anybody I met during my career, they all have very high aspirations. We all want to be open and honest, disclose the medical errors when they happen. But there's also this gap between our aspirations to be open and honest and what's really happening in hospitals and clinics today. We seem to lack that practical wisdom and moral courage to practice full disclosure, even though we really like it in principle. So today we'll be talking about medical errors. We'll define it, we'll talk about the gap, the reasons, the legal consequences of what happens if you fully disclose. What are the benefits? And what is that practical wisdom that we need to have so that we can go ahead and have that courage and fully disclose the medical errors? For today's purposes, medical error is a human error in healthcare, rather than the underlying condition of the patient that harms that patient. In 2000, Institute of Medicine reported that every single year, medical errors can harm over 1 million people, and they actually cause 98,000 deaths every single year. So how are we dealing with disclosure? If we have so many medical errors harming patients, what are we doing about these? Well, the tradition has been that we deny and defund that, right? Because we don't have standards. We don't have enough rules and laws and regulations that says you need to disclose fully to the patient when there's a medical error. Of course, as professionals who are held to high standards, doctors, nurses, very smart and wonderful people, we know there is a moral obligation and there's an ethical obligation to disclose when there's a medical error. And especially this is true because the patient we're dealing with doesn't have the education, they haven't been to medical school for 10 years, and they don't have the training to understand the medical error when that happens. They may think that it happened because of their underlying condition. Joint Commission does have a requirement to disclose to the patients the outcome of that healthcare treatment when the outcome, even if that outcome is different than what we anticipated. But there is no guidance as to how to disclose to patients, right? We don't have enough strategy or information to deal with that. So how are we dealing with it? In today's world, that reminds me of the note I received on my windshield a couple weeks ago. Apparently someone was in the parking lot and they hit my car. And they said, "I'm sorry, I'm writing this down because someone saw me hit your car and I'm pretending to write down my information." Right when I saw that, of course it made me feel a little better that they said sorry and really, really sorry. But what does that make you think when you see that? To me, I was like, yeah, it's nice that you're sorry. I don't know where you are, who you are. Maybe I would be angry if you came up to me and told me what happened, but who pays for the damage? And that car, my father bought that car for me. Even if you repair it, it's not going to be the same, but at least you should have the honesty and openness to come and talk with me. So today's disclosure in the medical area, that kind of reminds me of that, right? I had an orthodontist who didn't do what he was supposed to do, and then he came back and said, "I'm sorry." And I was like, "For what? I don't even know what you're talking about." So a lot of medical errors that are harmful to the patients are not disclosed to the patients, and there are several reasons for that. First of all, there's a gap between wanting to be open and honest and the fact that we like the principle, right? We like to be honest and open. We like to be good people who are spiritual and who are rightful. But we don't really have a lot of guidance as to how to disclose these medical errors. We have questions, we have challenges and obstacles. And there's also the fact that the doctors or the healthcare professionals have a narrow definition of disclosure, right? In their professional mind, they believe if the disclosure is not going to help the patient, why bother? That's only going to make them more angry and it's not going to help anything. As a patient, again, when I say patient, it's not patient versus doctor or patient versus healthcare professional. Healthcare professional are also included in that big bubble that's called patient, right? We have kids, we have families, we can also be patients. As patients, we believe it's our body. We have a right to know, even if that medical error is very minor and the harm is very minimal, I want to know what happened to me so that I can take it from there. There is shame on the healthcare professionals' side. They are fearful of discipline or litigation. Therefore, we have the minimal disclosure that is similar to the note I found on my windshield. There was a study in Washington, and 10% of the patients, they reported that they actually found some emotional support in the healthcare clinics or hospitals about medical errors that caused them harm. 10%. So this picture shows us that even though there is support for the concept, there isn't really support for the context. So let's talk about what's preventing us. First of all, we have legitimate questions, right? How can we fully disclose? We don't really have an example. Actually, we do, and we'll talk about that today. And what do we say? Do we apologize? Do we explain? How much information do we provide? And do we compensate the victim or the patient in this case? Who talks to the patient? Is it the physician or the whole healthcare team or a disclosure coach, right? You could hire me today. I could come into your hospital and train your employees as to how to communicate that medical error to your patients. And when is the best time to disclose? Do we wait for the patient to figure out what happened? A couple of weeks ago, there was a patient, and luckily he was a healthcare professional himself. He was given 100 units of insulin when his regular dose was 10. He had to be taken to the ICU because of that. His blood sugar, again, that insulin level really messed him up. And when he woke up, he was still alive, luckily, and he started asking questions. But he knew how to ask questions. I don't know, if you give me 100 units of insulin and take me to ICU, I'll think it's because something was wrong with me, right? How do I know to ask questions? So the question for the healthcare professionals is, do we wait for the patient to figure out, or do we disclose the error as soon as we realize that it happened? And finally, what if this results in litigation or discipline? This brings us to the legal consequences. More than 30 states have apology laws. What these laws do is they actually do not let the patient to take the statement of apology to court and say, look, they apologized, therefore there must be liable. But this does little, because in 25 states, the protection is only regarding the statement of regret, right? Let's say you spoke with your patient and said, I'm sorry. That is protected. If you continue and say about what happened, that's not protected. In 4 states, there is full protection both for the apology and admission of fault. In 8 states, actually, the disclosure of medical errors is mandated by the state. And in Oregon and Pennsylvania, you have to provide notice of the medical error that harmed the patient in writing. So what is happening in Kentucky, right? I'm a proud Kentuckian. I've been here for 10 years. I wouldn't want to live anywhere else. But I read a quote by Mark Twain, and he said, when the end of the world comes, I will be in Kentucky, because anything that happens anywhere else happens in Kentucky 20 years later, right? In this case, hopefully it won't take us 20 years to get the apology laws. And even if we did have the apology laws, I want everyone to understand this very clearly. You can still be taken to court for full disclosure, even if you have the apology laws. Because what it does, again, it only protects the expression of regret, but if you have independent evidence of liability, you're still going to end up in court. There is one strong evidence rule that will apply to full disclosures. If you speak with your patient and disclose to them what happened, either you're a healthcare professional, you're a practitioner, administrator, that admission is admissible in court as evidence of liability. Even if you're not the institution, that can apply because you're the agency or the employee of that institution. But that's about it. If you look at every other rule, it seems like it's against the patient. Let's look at the subsequent measures. If the hospital or the doctor, they started doing something differently after the medical error that was committed harmed you, you cannot bring that in and say, look at this doctor. He harmed me. I got infected with MRSA. And after this, he started ordering pre-op antibiotics so it wouldn't happen again, right? But they cannot take that to court and show that as evidence of liability. Another rule, compromises. If the full disclosure is made and you're sitting down with the hospital administrator or disclosure coach and they're telling you they're really sorry and they would like to offer you some assistance in any way they can, that compromise cannot be taken to court and say, hey, they tried to compromise with me, they tried to do this, so they must be liable. They can't do it. So, and not only the fact that they tried to compromise, but also the statements and conduct in connection with that cannot be introduced. For example, if the doctor said, I'm sorry, it was my fault, it cannot be introduced into evidence. Another one that is really relevant, medical expenses. If someone came up to you as a patient and said, I would like to pay for your medical expenses so that you don't have to suffer, that statement cannot be introduced in court against that person, against that healthcare professional. What can be introduced is if you say, I'd like to pay for your medical expenses because it was my fault, that fault part can be introduced. So we see a lot of obstacles in patients' way to go to court. But really, let's talk about litigation. As an attorney, I have great mentors who have been in medical malpractice and medical negligence practice areas for a long time. And I had the privilege of sitting down and talking with some of the patients. First of all, this patient is harmed. He or she is suffering pain. And she is angry. She doesn't know what happened. She wants answers, right? What happened? Why am I this sick? And instead of finding the answers at the hospital, she is trying to find a lawyer. In this pain, she needs to find the energy and time to actually find a lawyer that can help her. And medical malpractice and medical negligence cases are extremely expensive, extremely complex. The attorney who is listening to the patient knows, that he will have to pay at least $50,000 to $150,000 out of pocket to even get started on this case. So unless the patient's damages are around $300,000, and I am really being humble here because I know the established, developed attorneys are not going to take the cases unless the damages are around $500,000. So you're actually looking at a patient who's been harmed by a medical error, who's trying to live their daily lives, and then they're trying to find an attorney who can help them. But the attorney, or if I'm sitting there, I have to tell the patient, unless you're dead or you lost a limb, unless your damages are around $500,000, I cannot help you. So that's the patient you have after a medical error. Let's say we have this attorney who's filthy rich and ready to help any patient that comes his way, right? Takes the case, finds the medical expert, and everything's ready to go. Juries are very defendant friendly. According to a report that came out about a couple months ago from American Medical Association, in 90% of the cases, juries actually prefer to give verdict for the defendants. So you have a patient who is really suffering. And if you're a healthcare institution who really disclosed everything, did everything right, explained the situation to the patient, and tried to compensate early in the process, you have a very strong defense. If you go in there and say, we did everything we could, we fully disclosed, didn't wait, we didn't cheat, we explained everything, you have a very strong defense. So when you think about it, you don't really have anything to worry about in terms of litigation. Dr. Freeman is the innovator of the full disclosure program at Lexington's VA. And he said, if your patient had to go lawyer shopping so that she could get some answers or fair compensation for her injuries that resulted from your medical error, you have already lost the battle. Fortunately, we have great developments. And let's start with Lexington VA. In 1987, by the way, one of the first full disclosure programs in the nation started here in Lexington. That is very exciting for me, and I hope you share the same excitement. In 1987, VA lost 2 big medical malpractice cases, totaling about 1.5 million. And after that, they decided to take a more proactive approach. In a way, they were saying, no, we are caregivers, and we will remain caregivers even when the outcome is unanticipated, because we don't want to delegate our ethical duties to the lawyers or the legal system. We can take care of our patients. University of Michigan, University of Virginia, Johns Hopkins, Harvard, Stanford, Children's Hospital in Minneapolis, Kaiser Healthcare Systems, St. Joe, all these hospitals are moving towards full disclosure so they can take care of their patients. We don't see a lot of reporting, and as a healthcare professional, you can understand why, right? No one wants to be mentioned in the same article that says medical error. But their reports are coming slowly, and we know what's going on in these healthcare institutions. There is another wonderful development in this area. Kovic is a medical liability insurance company in Colorado. Right now, they're serving a very small community, but hopefully that will get bigger. They started a program that is called 3R program. That stands for Recognize, Respond, and Resolve. They basically disclose the medical error, offer early compensation, and there is no fault for the physician. Basically, anytime there is an unanticipated outcome, the physician can voluntarily get Kovic involved, and they can take care of the patient from there on. There are exclusions. If the patient died, if they went and retained an attorney, if they made a written demand or a complaint to the board, they do not qualify. But other than that, patients are taken care of, and there is no waiver of right to sue. Meaning, even the patient received disclosure and compensation, they don't have to sign away their rights to sue. That means you don't have a written demand. That also means there is no entry into the National Practitioner Data Bank for the doctor. Results. In 5 years Kovic has been doing this, 4,000 incidents voluntarily disclosed to the patients. Only 500 payments. And the payment average is $5,600, whereas it could be up to $30,000. And the most important thing is, none of these 4,000 cases proceeded to litigation or trial. That is significant. You don't waste time, you don't waste money, and you take care of your patient yourself. And because the doctors' names are not entered into National Practitioners Database, it's wonderful for everybody. Both the practitioners and the patients are very happy with the results. So let's talk about the benefits. Litigation costs go down significantly. At University of Michigan, it went from $5 million to $1 million. In VA, it was similar. Their numbers are not very clear, but they definitely retain some unanticipated financial benefits. Another thing, 50% drop in medical malpractice suits. Significant study by Leapfrog. They said in the hospitals that have full disclosure programs, they have witnessed lower mortality, meaning it improves the quality, it improves the patient safety. And once you're fully disclosed, you have a much better and stronger defense when there is a litigation. Again, patient safety improves, and you definitely improve your defense if there is litigation. Again, just like Dr. Kavanaugh mentioned, think about this simply. You're in an institution and you still have concerns about human resources, right? If you are not disclosing human medical errors to your patients, your staff knows, right? Your nurses, your allied healthcare professionals, your doctors, they know what's going on. And if the medical error is not disclosed, what kind of message are you sending to your staff? That it's okay to not be honest. It's okay to not be open. Is that the kind of message we want to send to our colleagues? I absolutely think that, especially in medical industry, that's not the case. You have opportunities for forgiveness. Of course the patient is angry at first, but through effective communication, we can definitely overcome that. And it reduces the likelihood of litigation. Again, if we think that the legal consequences are the only thing we have to worry about if we don't fully disclose, we have to think again. You know, let's look around the room. Everybody has an iPad, everybody has an iPhone, or something similar, right? The role of media in every industry today is significant. So if you look at the reviews for the doctors, or reviews for the hospitals, or blogs, or any type of social media that has significant effect on your customer service, we need to think about that as well. So what do? We put in a system, from what we talked about, we put in a system to prevent medical errors. If the error cannot be fully prevented, prevent the harm to the patient so that there is a wall in between. If the patient is harmed, investigate and disclose as soon as possible. Hire a disclosure coach or train your providers on disclosure. Provide a fair compensation. When we think about what is the right thing to do, there's usually a dilemma between what is the right thing to do in our minds versus what is the required thing or profitable thing or requested thing, right? And we try to come up with rules, laws, and regulations. Rules are not what is going to get us where we need to be. Virtue and character and leadership is what is going to get us where we need to be as a society, and especially in the healthcare system. And why is that? Because in my experience, I know healthcare professionals are really the smart of smartest, right? And I cannot imagine anyone here looking at a law or regulation or rule by the hospital and not being able to find a crack, right? Regardless of how many rules you have, how many laws you have, we will be able to find a crack if we want to. So what matters is the practical wisdom. And the practical wisdom is the will to do the right thing and the desire and the skill to find out how. So when one of your patients is harmed, do the right thing. Take responsibility, take care of the patient, provide fair compensation from the perspectives of human resources, productivity, proactivity. Providing full disclosure is the wise thing to do. Thank you.
Thank you, Helen. I can tell from a personal family experience that full disclosure is something that will tend to reassure the family. It will also tend to allay some of their frustration and anger. And I'll tell you about two instances which have happened. One is with my wife's father, who was hospitalized in facility, not in Kentucky. Neither of these are Kentucky stories. And he developed not only a bed ulcer, but also a corneal ulcer. And at the same time, was fed by NG tube post-op into his lungs. And that turned out to be a fatal event. The nursing staff there had full disclosure. The one nurse, I believe, even broke down and cried and apologized. And although the family was upset, and I should add the corneal ulcer and bed ulcer occurred then after this as things were deteriorating. And he passed on. His medical bills were written off by the facility. But some of the family, after the event, even wrote an op-ed in the paper complimenting the care that he got at the hospital by the nursing staff. And that was kind of a huge turnaround, as you can imagine, in the situation. Of course, not all family members agreed with that op-ed, I have to tell you, but they were a long, long ways from filing suit. The other family member I had, which was a cousin-in-law, at age 63 and was relatively healthy, had congenital aortic valve stenosis, underwent angiography and developed staph sepsis, was admitted to the hospital, developed a stage 4 bed ulcer, which is as big as it's on neverevents.org if you want to go to the website. It's huge. You put a baseball in it. Developed C. diff, and he died. And through this process, the family's impression was that the hospital was trying to deny any culpability or anything which was at their fault. And of course, the family was very upset at this, and they've been, needless to say, very much after that facility for the past year and a half. And their main concern is making sure that this doesn't happen again. They would like to have just an I'm sorry. And the family is fairly, they have, they're fairly well off financially, and so money really is an object.